Hi, I'm David Liew, reporting once again for RoomNow.com from ACR 2020, the virtual conference. Wanted to tell you a little bit about a really interesting abstract from the plenary, which looked at warfarin use and end-stage osteoarthritis, represented by knee and hip replacements, so knee and hip osteoarthritis. It was from Tina Nyogi's group at Boston University, and what they did was that they had a look at whether there's an association between these two things in a big UK primary care data set. Now you might be asking, why might there be an association? Well, in fact, vitamin K, a lot of proteins in bone and cartilage are dependent on vitamin K as a cofactor. We know that some of the mutations that can occur and related to vitamin K can be associated with osteoarthritis. And we know as well that vitamin K supplementation has trended towards less osteoarthritis in randomized controlled trials. So we haven't really had that chance to examine this previously because patients who were on warfarin and they didn't have any other real choices for anticoagulation. Of course, now we have the novel oral anticoagulants, the direct-acting oral anticoagulants, and that's really given us a chance to be able to try and compare the two. We've got enough data now, and that's what's been looked at in this analysis of these GP primary care, this primary care data from the United Kingdom. So looking at that, they had analysed whether there was an association in atrial fibrillation patients between warfarin and knee and hip replacements and NOACs and knee and hip replacements. They, of course, thought about confounders and corrective flows from the out. And really what they showed was that there was a strong association with warfarin and osteoarthritis in comparison to the patients on NOACs. And that stood there even after things were adjusted for in the multivariable logistic regression, but also once it was considered about there might be practice-to-practice variation in the cluster analysis looking at that. The association was stronger for knee replacements, so knee osteoarthritis with an adjusted odds ratio of 1.48. So that's really something which really does provoke some questions. Should say as well that in this, the duration of warfarin usage led to incremental increases in risk, both for the total of knee and hip replacement. So really that gives us a sense of another pathway which might be really important in osteoarthritis. I think there's obviously a question regarding warfarin use in osteoarthritis in general, especially when we've got choices. And if those choices are equal in certain groups, and that's one thing in itself. But maybe this tells us a little bit more about osteoarthritis in general and the pathophysiological processes that underlie it. For more about osteoarthritis, pharmacoepi, and about everything that's happened at ACR 2020, head along to roomnow.com.